Intimate wellness after 60, a gynecologist's warning on the dangers of neglect. Have you ever found yourself thinking, at this point in my life, intimacy is no longer a priority? Or perhaps you have quietly ceased paying mindful attention to your body's specific needs, operating under the assumption that dedicated self-care is a pursuit reserved for younger women. If this sentiment resonates with you, I urge you to pause with me for a moment, because neglecting intimate self-care after the age of 60 does not merely impact your capacity for pleasure. It has the potential to quietly compromise your health, your daily comfort, and even your fundamental confidence in ways that most women are never ever warned about. I am Dr. Lily Stones, a gynecologist with more than 3 decades of experience dedicated to caring for women just like you. Throughout the decades, I have observed one particular mistake more frequently than almost any other. Women assuming that intimacy and personal self-care cease to matter after the menopausal transition. And allow me to tell you, the truth is the precise opposite. While your body may indeed change, your intrinsic need for healthy circulation, for physiological protection, and for feeling deeply connected to yourself does not simply vanish. In fact, after menopause, your tissues naturally become more delicate, your blood flow to the pelvic region slows down, and your body's natural lubrication diminishes. If you choose to ignore these new realities, the associated risks do not just manifest in the bedroom. They can appear in your life every single day, taking the form of persistent discomfort, recurrent infections, or even a significant loss of pelvic strength. Wes, let me provide you with a clear example. I once cared for a woman, whom I will call Margaret, who at 68 years old, came into my office with a primary complaint of constant maddening itching and burning. She had not been sexually active for many years, and she confessed to me with a palpable sense of embarrassment, "Doctor, I just thought this was what happens when you get old." But after a thorough examination, I came to realize that the genuine problem was not her chronological age. It was the fact that she had completely stopped caring for her intimate health altogether. There were no specialized moisturizers, no gentle cleansing practices, no pelvic strengthening exercises. Her tissues had become so thin and dry, a condition known as atrophy, that even the simple act of walking long distances was causing her considerable discomfort. Margaret was unaware that simple, consistent self-care habits could have prevented her from enduring years of unnecessary suffering. And Margaret is far from alone in her experience. According to the esteemed Mayo Clinic, up to 50% of postmenopausal women experience the symptoms of vaginal dryness, and a great many more face an increased susceptibility to urinary tract infections, simply because their natural circulation and protective physiological barriers decline with age. Yet very few medical professionals speak openly and proactively about this subject. That pervasive silence leaves countless women believing that it is normal to live with discomfort, when in reality there are concrete steps you can take to protect and preserve your intimate health well into your 60s, 70s, and beyond. Here is what I would like you to consider. When you cease to water a flower, does it continue to bloom? Of course not. The very same principle applies to your body. Intimate self-care is akin to a gentle, consistent watering. It keeps your tissues flexible, it protects your circulation, and it preserves that essential sense of vitality. Without this care, the body can wilt at a much faster rate than it has to. So in this discussion, we are going to open the door on a topic that has been locked away for far too long. I will explain precisely why self-care is so critically important. After 60, I will detail the 5 most dangerous mistakes I see women make, and I will share the simple, natural solutions that you can begin implementing today to protect your body and your confidence. Even if you believe this subject no longer applies to you, I encourage you to stay with me, because what I am about to share could potentially save you from years of discomfort and help you rediscover a part of yourself you may have thought was gone forever. Before we delve deeper, allow me to ask you something. Do you personally believe that intimate self-care still holds importance after the age of 60? Or have you, like Margaret, felt that it is simply too late? Please share your thoughts in the comments section below. I read them all, and your voice could be the one to encourage another woman who feels alone on this journey. When I reflect upon the many women I have cared for over the past 3 decades, there are 5 distinct mistakes that I see manifest time and time again. They are often small choices that seem entirely harmless in the moment, but over time, they quietly coalesce to create much bigger problems that can affect not just your capacity for intimacy, but your overall well-being. The first mistake is overcleaning with harsh soaps or antiseptic products. Many women express to me that they want to feel fresh, so they scrub with perfumed body washes or use douches they have seen advertised. But according to the Cleveland Clinic, the vagina is a self-cleaning organ. Overwashing strips away its natural protective barrier and eradicates the beneficial bacteria that your body relies upon to maintain a healthy balance. I once had a patient, Elena, who was in her 70s and had developed chronic debilitating itching and recurrent infections. She genuinely thought she was doing the right thing by rinsing twice a day with a strong antibacterial soap, but that very routine was methodically destroying her body's natural equilibrium. After she made the simple switch to using only gentle, warm water and ceased using harsh chemicals, her discomfort faded away within a matter of weeks. The second mistake is ignoring the dual needs of hydration and natural moisture. After menopause, as estrogen levels drop, your tissues begin to lose their natural elasticity. Without regular moisturizing, those delicate tissues can become fragile and prone to developing tiny tears, which can lead to pain with movement and a significantly higher risk of infection. Yet so many women resign themselves to thinking, dryness is just my new normal. I tell my patients, just as you would not cease to moisturize the skin on your face after 60, you should not stop moisturizing your intimate skin. A simple, safe, high-quality water-based gel or a dedicated vaginal moisturizer can make a profound and positive difference. The third mistake is avoiding intimacy altogether out of a fear of discomfort. This one truly breaks my heart. I have met women who, after a single painful experience, made the decision to never try again. In doing so, they withdraw not only from physical intimacy but also from the emotional closeness that often accompanies it. What they do not realize is that avoiding intimacy actually reduces blood flow to the pelvic region and can accelerate the process of tissue thinning. It becomes a self-perpetuating cycle. Less intimacy leads to more dryness, and more dryness leads to more pain. Even gentle forms of intimacy, such as touch or mindful self-pleasure, can help to maintain healthy circulation and preserve your comfort. The fourth mistake is believing that lubricants are intended only for sexual intercourse. Lubricants are, in fact, tools for comfort, not just for a specific act. Using them during general self-care or as part of your daily routine can help to prevent the micro-tears I mentioned, reduce irritation, and even restore a sense of confidence. A woman I worked with, Janice, aged 66, whispered to me once that she felt deeply embarrassed to purchase lubricants at the store. But when she finally summoned the courage to try one, she laughed and said, "Why didn't anyone tell me about this 20 years ago?" Sometimes the simplest tools are the most powerful ones. And finally, the fifth mistake is forgetting about the pelvic floor. Just because you are past menopause does not mean that your pelvic muscles no longer matter. In fact, they matter more than ever before. Weakened pelvic floor muscles significantly increase your risk of urinary leakage, pelvic organ prolapse, and even a loss of sensation. Yet so few women regularly practice pelvic floor exercises like Kegels. I encourage my patients to treat them like brushing their teeth. Tiny, daily habits that offer protection for years to come. One of my patients, Linda, aged 72, used to avoid going out in public for fear of having an accident. After just 3 months of guided pelvic floor exercises, she completely regained her control and proudly told me, "I finally feel like myself again." What all of these common mistakes share is not any malicious intent, but rather a profound misunderstanding. No one ever explained to these women that their bodies still deserve and in fact require gentle, thoughtful, and consistent care. And it is not their fault. For decades, our society has taught women to either remain silent about matters of intimacy or to believe that after a certain age, it simply does not matter anymore. But it does matter. It matters for your health, for your dignity, and for your daily comfort. So here is a question for you. Looking back at these 5 common mistakes, which one do you think you might have inadvertently fallen into without even realizing it? Be honest with yourself. Acknowledgement is the very first step toward positive change. Share your thoughts in the comments, and you might just inspire another woman to recognize her own habits and take empowering action. Now that we have uncovered the common mistakes, let's focus on what you can proactively do, practical, natural habits that will protect your intimate health after the age of 60. The beauty of this approach is that you do not need expensive prescriptions or complicated time-consuming routines. Often it is the small, consistent habits that yield the biggest and most lasting difference. The first habit is to focus on hydration and nutrition that actively supports your circulation. According to the National Institutes of Health, dehydration does not just affect your skin or your energy levels, it directly impacts the moisture balance of your intimate tissues as well. I encourage women to drink water steadily throughout the entire day, not just when they feel thirsty. Beyond fluids, your diet truly matters. Omega-3 rich foods like salmon, flax seeds, and walnuts are known to improve blood flow and enhance tissue flexibility. Vitamin E, found in almonds or sunflower seeds, can also support the health of your skin, both inside and out. One of my patients, Teresa, aged 67, told me that after she started adding a tablespoon of ground flaxseed to her oatmeal each morning, she noticed not only better digestion, but also a significant reduction in dryness and irritation. The second habit is gentle, daily moisturizing. Just as you care for the skin on your hands and face, your intimate skin requires your attention too. Using a fragrance-free, water-based moisturizer or a specialized vaginal gel a few times a week can help to restore elasticity and reduce the occurrence of those painful microtears. Many women are surprised when I compare this practice to putting lotion on chapped hands. It is truly that simple, yet it makes a world of difference in their comfort. The third habit is incorporating pelvic floor exercises. The Mayo Clinic has long emphasized the critical importance of Kegel exercises for women, especially after menopause. These exercises do not just prevent urinary leakage, they also improve circulation, enhance muscle tone, and can even heighten sensation. I often recommend starting with 3 sets of 10 squeezes per day, holding each contraction for about 5 seconds. To make it easier to remember, try linking this habit to another daily activity, like doing your Kegels every time you brush your teeth. One patient, Alice, aged 70, who had quietly struggled with incontinence for years, not only regained her control but also told me, "Dr. Stones, I feel younger just walking down the street without that constant fear." The fourth habit is embracing movement that keeps your blood flowing. Activities like yoga, walking, or light stretching do not just benefit your heart and your joints. They also send vital, oxygenated blood to your pelvic region. Increased blood flow directly translates to healthier, more resilient tissues. I remember a retired school teacher, aged 72, who joined a local gentle yoga class. After a few months, she shared with me that she had not felt that much energy or such a sense of intimacy since her 50s. Sometimes the best medicine is simply moving your body with kindness and intention. The fifth habit is embracing gentle intimacy and touch, even if you are not currently sexually active with a partner. Intimacy does not have to mean intercourse. It can mean mindful self-pleasure, massage, or simply reconnecting with your partner in non-demanding, affectionate ways. The Cleveland Clinic points out that regular stimulation increases local circulation, which in turn helps to prevent tissue thinning and dryness. For one widowed patient of mine, embracing intimacy after 65 meant rediscovering her own body without shame or judgment. She told me, "It's not about sex for me, it's about remembering that I'm still alive, that I'm still connected to myself." That profound shift in her perspective brought her both immense comfort and renewed joy. And here is a quick win tip for you. If you are feeling hesitant about where to begin, start with one simple, foundational change. Increase your hydration. Every time you pour yourself a cup of coffee or tea, drink a full glass of water alongside it. Over time, this single habit will support your tissues, your energy levels, and your overall health. It is small, it is doable, and it sets the stage perfectly for the rest of your self-care journey. These natural habits are not just about preventing problems, they are about helping you to feel at home in your own body again. They serve as a powerful reminder that aging does not have to mean a steady decline. It means adapting with wisdom and grace. You do not have to settle for discomfort, and you certainly do not have to give up on intimacy with yourself or with others. So let me ask you, of these habits, hydration, moisturizing, pelvic floor exercise, movement, or gentle intimacy, which one feels the easiest for you to begin with today? And which one feels like the biggest challenge? Please share your answer in the comments, because I promise you, many other women are wondering the very same thing. When most women hear the phrase intimate self-care, they think only of preventing discomfort or warding off infections. But what I have witnessed time and time again in my practice is that this kind of self-care does something even more powerful. It restores intimacy and rebuilds confidence in ways that touch every single corner of a woman's life. Let me tell you about a couple I once worked with, Karen and Bill, both in their mid-60s. Karen came to me feeling embarrassed, ashamed, and distant from her husband. She had not been intimate with him for nearly 3 years. Every attempt they had made had ended in pain for her, so she had simply withdrawn completely. She told me, her voice heavy with sadness, "I feel like I've lost not only my body but my marriage as well." Together we created a gentle, consistent self-care plan for her, focusing on hydration, moisturizing, and pelvic floor exercises. Within a few short months, she began to notice less dryness, more physical comfort, and most importantly, a significant shift in her self-confidence. When she began to feel safe and comfortable in her own body again, she could finally let her emotional guard down. She and Bill began to rediscover their closeness, not with a sense of pressure or expectation, but with a newfound tenderness and patience. She later shared with me, tears of gratitude in her eyes, "I didn't just get my intimacy back, I got my relationship back." Stories like Karen's serve as a constant reminder to me that self-care is never just about physical health. It is also about the emotional freedom to show up fully and authentically in your relationships. When you tend to your intimate health, you actively reduce fear, shame, and hesitation. You replace those negative emotions with comfort, trust, and a deep-seated sense of self-worth. That confidence radiates outward. You begin to stand taller. You laugh more easily. You even enjoy your social life more because you are no longer carrying the secret burden of discomfort or insecurity. The science fully supports this. According to the Mayo Clinic, women who maintain sexual activity and a practice of self-care after menopause consistently report higher levels of satisfaction with their lives, lower rates of depression, and improved circulation and pelvic health. It is not simply about the physical act itself. It is also about the beneficial hormones that intimacy releases, such as oxytocin and endorphins, which naturally lift your mood and reduce stress. This means that self-care does not just change your experience in the bedroom, it changes your brain chemistry in ways that make your entire daily life brighter. I often use this analogy with my patients. Imagine your intimate health as the foundation of a house. If that foundation is cracked, crumbling, or neglected, the entire house feels unstable and unsafe, even if the walls appear to be fine on the surface. But when that foundation is well cared for and strong, the whole home stands firm and secure. Your body is the same. Intimate self-care strengthens your very foundation, giving you stability not only for intimacy, but for a profound sense of confidence in every single aspect of the aging process. Another one of my patients, Rosa, aged 70, once whispered to me that she felt completely invisible after menopause. She said, "I don't feel attractive. I don't feel alive." We began with small, manageable steps: increased hydration, a gentle moisturizer, and daily pelvic floor exercises. After 3 months, she did not just feel physically better, she walked into my office with lipstick on, her hair beautifully styled, and a genuine sparkle in her eye. She told me, "I realized I'm not invisible, I'm still me. I just needed to remember how to care for myself." That remarkable transformation was not about beauty products or seeking external approval. It was about reclaiming a sense of comfort in her own skin. So when women ask me, "Dr. Stones, is it really worth the effort?" my answer is always, unequivocally, the same. Yes, because this is not just about your tissues or your circulation. It is about your freedom to enjoy connection, your courage to feel desired, and your fundamental right to live with dignity and joy, no matter your age. Let me ask you a personal question. Do you see self-care as something you do just to avoid problems, or as a way to truly enhance your confidence and your relationships? I would love to hear your thoughts in the comments. You might be surprised by how many other women feel exactly as you do, and your honesty could be the very encouragement they need to start their own journey. We have covered a great deal of important ground together today, so let's take a moment to breathe and reflect. Ignoring intimate self-care after 60 is not just about losing a little bit of comfort. It can mean living with chronic dryness, recurrent infections, pelvic weakness, and the slow, sad fading of intimacy that so many women mistakenly assume is just a normal part of aging. But you and I now know better. It does not have to be that way. We began with the truth that your body, even after menopause, still requires care, circulation, and mindful attention. We explored the 5 common mistakes I see most often: overwashing with harsh products, ignoring hydration and natural moisture, avoiding intimacy out of fear, believing lubricants are only for sexual intercourse, and forgetting about the crucial importance of the pelvic floor. Then we shifted into the hopeful part, the natural, sustainable habits that truly work. Drinking plenty of water and eating nutrient-rich foods, gentle, consistent moisturizing, daily pelvic exercises, movement that increases circulation, and yes, embracing intimacy in whatever form feels right and joyful for you. And finally, we talked about the real profound gift of self-care. not just healthier tissues, but restored intimacy, renewed relationships, and a deep abiding confidence that shines through every part of your life. Because intimate self-care is not about vanity, it is about dignity. It is about reminding yourself and the world that your health and your joy are worth protecting, no matter your age. I want you to picture something. Imagine two women, both at the age of 70. One shrugs off her changing body, ignores any form of self-care, and quietly withdraws from all forms of intimacy. Over time, she finds herself facing discomfort, shame, and a profound sense of loneliness. The other woman embraces small, consistent self-care habits, hydration, movement, and gentle touch. She remains comfortable, connected, and confident. Which of those two paths would you rather walk? The choice is entirely yours. As your gynecologist, I want you to know with certainty that it is never too late to start. Even if you have neglected these habits for years, your body has an incredible capacity to respond with healing when you begin to care for it again. The earlier you start, the better, of course, but the door to positive change is always open. So here is what I would love for you to do. Take just one small step today. Drink an extra glass of water, practice 10 Kegels before you go to bed, apply a gentle moisturizer tonight. Small, incremental steps are what lead to lasting, meaningful change. And if you are ready to commit to your health, please share in the comments which step you are choosing to take. When you put your intention into words, you are not just helping yourself, you are encouraging every other woman watching this to take action too. Before we close, let me ask you for a final reflection. When you think of intimate self-care, do you currently see it as an obligation, or could you perhaps begin to see it as a precious gift? A gift that you give to yourself, one that preserves not only your physical health, but also your joy and your profound sense of being alive. And please remember, if you found value in today's video, please subscribe so you do not miss the rest of this series. We will continue to explore the truths that no one tells women over 60, from common self-care mistakes to the simple solutions that can help you live with comfort and confidence. And before we close, let me remind you this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.